Hello. Today I am going to inject platelet rich plasma into the knee of a patient. This patient is in his 60s. He is suffering from grade 3 osteoarthritis. He has got bilateral grade 3 osteoarthritis. I have assessed him and I recommended platelet rich stroma as a treatment for both his knees. The results of platelet rich trauma are excellent and long-term results are available. You can check them out on my website. However, he chose to undergo a platelet rich plasma or PRP treatment. I will be injecting PRP into the knee under ultrasound guidance. I will be injecting a high dose of platelet rich plasma. With a high dose, one does not have to repeat the PRP injections on a weekly basis. A high dose of platelet rich concentration is defined as one which contains 10 billion cells per liter. To achieve this, one needs to spin the blood twice to get a sufficient concentration of more than 5 times the basal concentration. So that is the first requirement for a durable result or long-term result after a PRP injection. The results can last from 6 months to 2 years in my practice. There are patients who are still satisfied at 5 years after a PRP injection. You can check out these results here. I will be injecting PRP into the knee under ultrasound guidance. Ultrasound guidance enables the orthopedic surgeon to place the needle very precisely into the knee joint and delivers the PRP with accuracy. This will give a highly predictable result and the patients will feel very satisfied and they will get prompt pain relief. This is to be contrasted from blind injections, which is given by just sticking a needle into the knee joint from below. The ultrasound guided injection is given from above and enables accuracy and efficacy and a predictable result. So you will see the procedure being done. I will show you the patient, I will show you the injection procedure, how PRP is prepared and how the PRP is injected into the knee under ultrasound guidance.
வாங்க சார் படுத்துங்க.
என்ன ஊசி சார்?
So blood is already coming. 30 ml of blood is required for double spin. With this preparation, so the blood ranges from 15 to 30 ml. For double spin PRP, we'll get about 5 ml of PRP, highly concentrated. This is the procedure room, ultrasound machine. I will be using this linear probe to clean the knee with Betadine lignocaine spray, preparing the area to a cold spray.
Local anesthesia
PRP
infiltration.
is ready. We'll be withdrawing the PRP into a syringe. Double spin has been done. The amount of platelets will be 5 times from the basal value, which will give around 10 billion platelets per liter of blood. So if we give this amount of platelets, then there is no need to repeat the PRP injection on a weekly basis and the effect will last up to 2 years. Otherwise, if you just give a low dose PRP, then the effects will not last maybe a month or up to 6 months and that's it. Sterile gloves, syringe. So we've got 4 ml of PRP, longer needle, and now I'm going to place the probe over the knee joint and you can see the area from where I am going to approach. You can see the needle moving there. It's inside the effusion. Okay. Now going to just clean it up and apply a dressing. That was the platelet rich plasma or PRP injection into the right knee. At the end of the procedure, you have seen he has no pain. And you've seen on the ultrasound machine that the PRP was delivered exactly in the place of the effusion. You could see the tip of the needle. So if you are suffering from knee osteoarthritis and don't want to undergo surgery, then biological injections like PRP or PRS, depending on the severity, will help you get control of your pain, and they will even regenerate tissue. They will stop the inflammation, modify the immune response, and you will have a good long-term result. So if you found this video informative and helpful, share it with your relatives or friends. Subscribe to my channel and press the bell icon to receive notifications when I upload videos like this in the future. See you in the next video. Thank you and bye.